Across the country, a concerning trend is emerging on our playing fields and in our emergency rooms. Young athletes, particularly those between the ages of 12 and 15, are suffering from a dramatic increase in anterior cruciate ligament, or ACL, ruptures. This isn't a small statistical blip. It's a significant public health issue that has been amplified in the years following the COVID-19 pandemic. Before 2020, severe knee injuries in this age group were often different, typically involving fractures where the ligament pulls a piece of bone away. Now, orthopedic surgeons are seeing more complete mid-substance tears of the ligament itself, the kind of injury once more common in collegiate or professional athletes. The reasons behind this surge are complex, but many experts point to the detraining and retraining cycle caused by the pandemic. During lockdowns, organized sports were halted, and many teens became more sedentary. Their bodies, accustomed to a certain level of physical stress, lost crucial muscle strength, coordination, and what we call proprioception, the body's innate sense of its position in space. When sports returned, often with an accelerated and intense schedule, these deconditioned bodies were simply not prepared for the high-impact demands of competition. This created a perfect storm for injury, as underdeveloped muscles fail to protect the knee joint during sudden movements. This isn't just about kids being out of shape. It's about a fundamental disruption in the development of motor control. The neuromuscular pathways that allow an athlete to land from a jump safely or pivot sharply without putting dangerous force on the knee were underdeveloped or had weakened. Think of it like a car that's been sitting in a garage for a year. You wouldn't take it directly onto a racetrack without checking the tires, brakes, and engine first. We essentially sent our young athletes back onto the field without that crucial pre-season tune-up, and their bodies are paying the price for that abrupt return to high-intensity play. The statistics are telling. Some recent studies show that over the last 15 years, ACL injuries among US high school athletes have increased by a staggering 26%. The post-pandemic era has only poured fuel on this fire. It's a clear warning sign that the way our children engage with sports has changed, and our approach to their health and safety must change with it. We are no longer just dealing with sprains and strains. We are facing a wave of serious, potentially career-altering injuries in a population that is still growing and developing, making the stakes higher than ever before. The nature of these injuries has fundamentally changed. Before the pandemic, a young teen presenting with a serious knee injury was more likely to have an avulsion fracture, where the ACL pulls a chip of bone off the tibia, or an injury to the growth plate itself. These were still serious, but they were bone injuries. Today, we are seeing a dramatic shift toward complete intraligamentous ruptures, the ligament tearing right in the middle. This is a crucial distinction because a ligament tear doesn't heal on its own and almost always requires complex reconstructive surgery, which carries its own set of risks for a growing child. This shift in injury pattern is deeply connected to specific risk factors, with young female athletes being disproportionately affected. Research has shown that girls can be up to 8 times more likely to tear their ACL than boys playing the same sport. This is due to a combination of factors, including differences in anatomy, such as a wider pelvis that changes the angle of the knee, as well as hormonal influences and different patterns of muscle activation. Sports that involve a lot of pivoting, cutting, and sudden stops, like soccer, basketball, and lacrosse, are the highest risk activities for girls, as about 70% of these injuries are non-contact, happening during a routine landing or change of direction. For boys, the high-risk sports are similar and include football, lacrosse, and soccer. The common thread is the explosive, multi-directional movement that defines modern athletics. When an athlete lands from a jump with a straight knee or plants their foot to change direction, immense force travels through the joint. If the surrounding muscles, particularly the hamstrings and glutes, aren't strong enough to absorb that shock, the ACL is left to act as the primary stabilizer. It's a job it wasn't designed to do alone, and under that strain, it can easily buckle and tear, often with an audible pop. This convergence of factors, the post-pandemic deconditioning, the shift to more severe ligament tears, and the inherent risks for certain athletes, creates a challenging new landscape for sports medicine. We are no longer just treating an injury. We are confronting a pattern. Understanding who is most at risk and how these injuries happen is the first critical step. It allows coaches, parents, and medical professionals to move from a reactive stance of treating injuries to a proactive one focused on preventing them from ever occurring in the first place. When a young teen tears their ACL, the decision to operate is complex because they are still growing. The growth plates or physes at the ends of the thigh bone and shin bone are active and vulnerable. Any surgical procedure that damages these areas could potentially stunt or alter the growth of the leg. For this reason, surgeons must first carefully assess the child's skeletal maturity, often using hand X-rays and a system called Tanner staging. Based on how much growth a child has remaining, one of three main surgical approaches is chosen to reconstruct the ligament and restore stability to the knee. For the youngest patients, typically those in Tanner stages 1 or 2 with significant growth ahead, surgeons use a physical-sparing technique. As the name implies, this approach avoids crossing the growth plates entirely. The surgeon drills tunnels exclusively within the ends of the bones, the epiphysis, creating a pathway for the new ligament graft that completely bypasses the sensitive growth areas. While technically demanding, this is the safest option for prepubescent athletes as it carries the lowest risk of causing a growth disturbance. Advanced imaging during surgery helps ensure the tunnels are placed with pinpoint accuracy. For adolescents in the middle of their growth spurt, often in Tanner stages 2 or 3, a hybrid or partial transphysial technique is often preferred. This method strikes a balance between anatomical accuracy and physical safety. The surgeon drills a partial small diameter tunnel through the growth plate on the tibia but avoids the one on the femur. By using soft tissue grafts and modern fixation devices that suspend the graft in place, the contact with the growth plate is minimized. This approach allows for a stronger, more vertical graft placement, which is better for knee mechanics, while still significantly reducing the risk of premature growth plate closure. Finally, for older teens in Tanner stages 4 or 5 who are nearing the end of their growth, a conventional transphyseal surgery is performed. This procedure is very similar to what is done in adults, where the surgeon drills tunnels directly through the growth plates to place the graft in the most anatomically correct position. Since these athletes have little to no growth remaining, the risk of affecting their final height is minimal. Even in these cases, surgeons often use smaller tunnels and specialized techniques to be as gentle as possible, ensuring a stable knee that will last them a lifetime of activity. ACL surgery is only the first step on a long road to recovery. For teenagers, rehabilitation is arguably even more critical than for adults, and it requires a highly specialized approach. Adolescents have a much higher risk of re-tearing their new ACL graft. Some studies report rates as high as 30%, or tearing the ACL in their other knee. Therefore, their rehab protocol cannot just be a scaled-down version of an adult's. It must be tailored to their skeletal maturity, the biology of the healing graft, and their unique neuromuscular needs, with the primary goal being not just a return to sport, but a safe and durable return. The old model of returning to play based on a simple timeline, for example 6 or 9 months after surgery, is now considered outdated and unsafe for this age group. Today, the decision is based on meeting objective, functional criteria. Athletes must demonstrate that they have regained at least 90% of the strength, stability and function in their surgical leg compared to their uninjured leg. This is measured through a battery of tests, including strength assessments and a series of hop tests that challenge the knee's ability to handle impact and control movement. Rushing back before meeting these benchmarks is a leading cause of re-injury. Fortunately, technology is revolutionizing how we manage this long recovery process. Tele-rehabilitation platforms and specialized apps allow physical therapists to monitor a patient's progress remotely, ensuring they are performing exercises correctly and staying on track. Biofeedback sensors and even gamified exercises can make the repetitive and often tedious rehab process more engaging for teens, improving their adherence. Furthermore, we are seeing a major push for evidence-based injury prevention programs. These programs, which focus on neuromuscular training, plyometrics and strengthening, have been shown to reduce knee injury risk by over 25% when integrated into team warm-ups. To protect our young athletes, we need a coordinated effort. For families, this means encouraging participation in prevention programs and resisting the pressure to specialize in a single sport too early, which can lead to overuse injuries. For coaches and schools, it means making these short, effective warm-up routines a mandatory part of every practice. It also means educating athletes about listening to their bodies and recognizing the signs of fatigue. By shifting our focus from simply treating injuries to proactively preventing them, we can ensure that sports remain a source of joy, health, and camaraderie for our kids, keeping them on the field and out of the operating room.